everyone. Thank you so much for joining us today. I'm Tara, the Library Director at Long Beach Public Library. We're really happy to welcome you to the 2020 Active Living Series sponsored by Assemblywoman Missy Miller, the Katz Institute for Women's Health, and Northwell Health. This is a 4-week program for the Long Beach Public Library, and it's happening every Tuesday at 2:30 for the next few weeks on Zoom. Today's presentation, we're going to learn about making the most of your doctor's appointment with Lori Ginsberg, RN, MA, and a program director at the Katz Institute for Women's Health. And we're so grateful she's here to share her expertise. Just a few details before we get started. We'll be muting you during the actual presentation so we can focus on the information Lori will be sharing with us. But don't worry, we'll leave a few minutes at the end for questions. Feel free to use the chat feature on Zoom if you need to reach us at all during the presentation. Any questions posted there will be answered after the presentation. Now, before we get started and meet Lori, there's one more special guest we wanted to introduce. Assemblywoman Missy Miller is here to help us kick off this important health series.
Thank you. Thank you so much. You know, every year we do these senior seminars and they're so popular. We usually get such a nice crowd. It's because we are so fortunate to have wonderful experts to come and address all of these things that seniors are experiencing and thinking, and answering questions and offering exercise and wellness programs. It's such valuable information. This year it's quite unique because of the coronavirus. We're trying this in a new way, and it's virtual. And I know it's been difficult for a lot of people to try and figure it out, but there's no reason why we can't get you the information this way. Even though we're not physically in person, we are looking at each other. We are able to enjoy each other's company, and certainly able to get valuable information. Lori has always is full of expertise and wonderful answers. So I won't be staying through the whole thing because I am here with my son, Oliver, who has therapy in about 10 minutes. But I am happy to bring this to you, and I hope that you enjoy. Thank you.
Ready for me, Tara? Okay. So, hi everyone. My name is Lori Ginsberg, and I am the Program Director at the Katz Institute for Women's Health at Northwell Health. And we are an institute that is very aware of gender differences in health and try to approach all of our healthcare education and our treatment according to a person's gender, which can be very different if you're a man or a woman, things like heart issues and diabetes and things like that. So that's what we do. We bring educational programs out into the community, and we've been partnering with Assemblywoman Miller and the Long Beach Library for several years now. And Chris, we thank you, Chris Dalton, for all that you have done to make that happen. And this year it's great to be back. So we are virtual, but we are back. So on your journey to health, you'll need certain people to help out along the way. One of them is your doctor, and we'll show you how to get the most out of your visits, your initial visit, and actually all of your visits. Other people that can help you be more successful on your journey to health are your family and friends. You don't need to go it alone. And the more help that you have, the more changes you might make to your health, and the more positive changes you might make to your health, and the easier the changes will be. It's much easier to do it together. And just think, you might inspire your friends or your family to start on their own health journey. So I'm going to share my screen. Let's see if we can do that. Okay. think we're good. All right. So who is in your healthcare partnership? And healthcare is a partnership. Everybody plays a different role and everybody has a different piece of the puzzle. So who is in your partnership? It's your healthcare professional. It can be your doctor, it can be your nurse, it can be your physician's assistant or PA, it can be your nurse or nurse practitioner, it can be your pharmacist, it can be a therapist that you have. So that's who's in your healthcare partnership. Also, your family and your friends. Most important, when you are thinking about who is in your healthcare partnership, the most important thing is to find a doctor that you like and you trust. And you create a bond of trust and you open a line of communication. So you see in this cartoon, the doctor says, get to know us. Well, you as the patient say to the doctor, get to know me first, and then I'll get to know you. But open up a line of clear communication with your healthcare professional. Okay, so not all of what is on this slide is showing up, but the doctor-patient communication is a dialogue. So you share your health concerns with the doctor, and then the doctor asks questions about your symptoms. Then you answer the questions, and your doctor is the one who shares the diagnosis and the treatment. And then it's your responsibility to ask the questions to better understand the plan and the treatment, and then your doctor answers those questions. So here's how a conversation with your doctor might go. Let's say if the doctor says something about an acute myocardial infarction, what would he or she mean? You might not know what that means. So you say to your doctor, what is a myocardial infarction? And then the doctor will say, it's a technical term for a heart attack. And another example might be is if your doctor tells you to take medicine with food, does that mean before, during, or after a meal? And likewise, if they tell you to take it on an empty stomach, how much time do you need on either side in order to be considered having an empty stomach? And by the way, this is also a great question to ask your pharmacist. Okay, well, there we go. All right, so how do we find a doctor? The first thing that you can do is you ask for a recommendation from your family, your friends, your coworkers, from another doctor. And then when you find one, check your insurance plan for participating doctors and make sure that the doctor that you've chosen is on your insurance plan. You can check the website of a local hospital for participating doctors, and usually they have a Find a Doctor feature if you go on the homepage of the health system or the hospital. When you're choosing a doctor, please consider doctors who are board certified. Board certified means that they have extra years of training in their specialty and have passed special high-end exams to obtain their certification. So you might go to a surgeon for a plastic surgery procedure. If that doctor is board certified in surgery but not plastic surgery, they might not do it as well as the person who's had those extra years of training. So consider doctors who are board certified. Check the doctor's hours and location for convenience. Make sure that it's someplace that you feel comfortable going to. Make sure it's within hours that you feel comfortable going, that it's not late at night or so early in the morning that you have to set your alarm for very, very early. And make sure that you say that you will go to the doctor's office, not, oh my God, I can't drive 45 minutes or an hour to get to that doctor. And also choose a doctor of a sex that you're most comfortable with. So if you are a woman and you have, say, a gynecologist, and you're more comfortable with a woman, then by all means choose a woman. If you are a man and you need an exam and you need, say, a prostate exam, and you're more comfortable with a man doing that exam, then by all means look for a male doctor. So what happens if you find a doctor and you went to him and you just don't like him? You don't like the office, you don't like the doctor, whatever it is, you don't like his mannerisms. So one of the doctors in our office that you may have heard speak at the library, Dr. Penny Stern, she always says, if the doctor does not give you enough time, then it's time to find another doctor. As a patient, you are entitled to time so that the doctor can answer your questions and you can understand your medical treatment plan very well. Find someone that you trust, establish a rapport, find someone that you trust. Maybe you found that one of your friends or a family member liked this doctor very much. So find someone that you trust and make sure that you transfer your medical records. So your medical records actually do belong to the doctor. But HIPAA, I'm sure you've all heard of HIPAA, not only allows your doctor to give a copy of your medical records directly to you, it requires it. The doctor is required to give you a copy of your medical records if you request it. HIPAA, which is the same act that regulates our health information, how our health information is handled to protect our privacy, also gives us the right to see and obtain a copy of our records to review and possibly dispute. Just make sure that you check with the doctor ahead of time about the procedure to obtain the medical records. Some require written, some require a phone call, so please do check and have your records transferred. So you really do need to see your doctor regularly, not only when you're ill. And you should be going once a year for an annual well visit. And why do we think that that's so important for you to go when you're not really sick? Because it provides an opportunity for you to talk to your doctor about things that might be concerning you. It gives your doctor an opportunity to get to know you when you're not ill. So if they get to know you and you've been going to them once a year when you're not ill for a number of years, when you do come in and you're sick, and let's say you're coughing, the doctor would say to himself or herself, wow, I never heard Mr. So-and-so cough quite like that at any of our visits. And that helps him in his treatment and trying to figure out what's wrong with you and get a diagnosis. The other thing that your annual well visit is for is that you can do screenings for health issues. So this is a time when you can screen for certain kinds of cancers, and you can screen for diabetes, and when you're well, all of these things should be normal. So this is the time to do all of your screenings for health issues. The other thing that they can do is they can do immunizations to make sure that your immunizations are up to date. So for instance, maybe you need your pneumonia shots. Maybe you need a shingles vaccine. So your doctor would be, maybe you need a tetanus shot, and your doctor would be able to help you go through your records and see what immunizations you need and give them to you at that visit when you are well. The doctor is also able to evaluate your health based on your age. Certain ages predispose you to be at higher risk for certain diseases, so your doctor can know that also. And it's also an opportunity to reduce risk factors and take preventative measures. So you can talk to your doctor about things like changing your diet or getting more exercise or things that you can do to improve your health. So do see your doctor regularly, not only when you are ill. Most important thing I can say about going to your doctor's office, whether it's for a well visit or a sick visit, is come prepared. Prepare in advance. You see that this says it wasn't raining when Noah built the ark, so do plan ahead. And we're going to cover that in the next few slides to show you how. So how do we make the most of our first visit? Don't waste time at the doctor's office filling out paperwork. Ask them if you can fill it out online before your office appointment so they have all the information ahead of time. Ask if you can give them your insurance cards, take pictures of your insurance cards and send them so they have that. So you're not sitting in the office for a very long time waiting to see the doctor. Or you can bring the insurance cards with you, either way. But be on time. Very, very important that you be respectful of the doctor's time. You hope that they're respectful of your time and you should be respectful of theirs. And before you go, please call ahead and make sure that your records were transferred or that you have them with you. When you go to the doctor's office, bring with you a notebook or a journal and a pen or something to write with. So this way you can write down your questions, you can write down what the doctor says, and you will have it to refer to at a later time. Bring with you an updated medication list. And when I say an updated medication list, be sure to include all of your prescription medications with the name and the dosage, all of your over-the-counter medications that you take regularly or frequently, include those on your medication list and how often you take them, and also all the supplements that you're taking. And the reason that we say all the supplements is because many times the supplements can interfere with the way your prescription medications work. That's the same for over-the-counter. So if you are not responding well to a medication that a doctor gave you, it could be because of something else that you're taking. So make sure that you include all three things, prescription, over-the-counter, and supplements, when you give your doctor your medication list. Make sure you have an accurate, as best you can, an accurate family medical history. Make sure you tell your doctor if you have any allergies. Are you allergic to a medication? Are you allergic to grass or pollen? Are you allergic to certain foods? Because these are things that are very important when the doctor is compiling your treatment plan, very important for the doctor to know. Be clear about your medical history. If you're not 100% clear about it, look it up and then write it down in bullet points so that you can tell the doctor that you've had a certain kind of illness at a certain age. If you've had surgeries, or if you've had cancer, or if you've had other chronic long-term illnesses that the doctor needs to know about. Very important that everything that has happened in your medical life, you need to share that with the doctor so that they can get a complete picture of you as a person. Please list your current complaints and tell it like it is. If the doctor asks you if you get short of breath, don't shrug it off and say no. Then be specific about how often you're having that complaint. And we'll get to that in a little bit later slide. And also have questions to ask your doctor. Very important that if there are certain things that you would like to know about, write them down, because very often we get to the doctor's office, the doctor's talking, we're talking, he's telling us different things, and we get flustered, or we forget, or we concentrate so hard on what they're saying that we might forget questions that we had in advance. So very, very good idea to write down those questions in advance, have them with you at the visit. And when you list your symptoms, maybe it would be important to list your main symptoms, maybe not all of them. Be sure that you can see and hear as well as possible. Make sure that you tell your healthcare professional any difficulties you may have in seeing or hearing. Position yourself so that if you have a problem hearing, you can see the doctor's lips if that helps you understand what they're saying, or get closer to him or her if that helps. And make sure that any written instructions that are given to you are given to you in large print. And tell the doctor, can you speak louder? I have a little bit of trouble hearing. So at your well visit, there are some very important questions that you should ask your doctor. Why do I take the medications that I do? Ask your doctor and prepare these questions in advance. Why do I take these medications? If I have diabetes, why am I taking this medication? Why aren't I taking this medication? Excuse me. You can ask your doctor, what can I do to reduce my risk of disease? Should I exercise more? Should I eat differently? Should I see a specialist? Ask the doctor, are my screenings up to date? We talked about this before. My screenings up to date. Did I get screened for colon cancer? Did I have a mammogram? Did I have a prostate exam? And are my immunizations up to date? Is it time for my flu shot? Is it time for my pneumonia shot? Do I need a shingles vaccine? So all of these questions, please prepare in advance and bring with you. The following steps will help you work best with your doctor at any visit. So remember to list your main questions and concerns. So in between visits, if you have a concern about something that you're doing and it can wait until you see your doctor, write it down. Another thing that's a really good trick is to take the 2 questions that are most important to you and ask them of the doctor at the beginning of your visit and say, you know, Dr. So-and-so, before you get started examining me or asking me questions, I just have these 2 questions that I need you to answer. And the reason that I say that is because if these are the most important questions for you, waiting until the doctor is running out of the room to the next patient, or they're short on time, or you might not remember at the end of the visit, it's really a good idea to do it at the beginning of the visit so you know that at least your 2 most important questions will be answered up front. When the doctor gives you a treatment plan, repeat back to the doctor the key points in that visit, such as, what's my diagnosis? Tell him repeat back the diagnosis, repeat back the treatment, and repeat back the side effects of any medications to be sure that you understand it. And again, ask for written instructions. Good to have written instructions so that you keep it in that notebook or journal and you always have it to refer back to. When you are reporting your symptoms and when you are reporting your treatment, be honest. Be honest. Always tell your doctor the truth. A doctor's main responsibility is taking care of their patients, and to do this effectively, they require honest answers to health and lifestyle related questions. You may be too embarrassed to disclose an unhealthy habit or think that it's irrelevant. However, you need always to remember that the doctor is basing his treatment on what you're reporting. So if you're leaving something out, he could be making a different decision than if you tell him the truth. So if the doctor is unaware of the behavior, or that you haven't been taking your medication, or that you haven't been eating what you're supposed to be eating, it's difficult for them to provide effective care, and it may even cause them to make decisions that put your health at risk. So always tell your doctor the truth. Keep track of your symptoms between visits and share them with your doctor. So if you're on a new medication, it's always a good idea to write down if you have any side effects. If the doctor is saying that you need to exercise 30 minutes a day, 5 days a week, and you can only do it 3 days a week, make sure that you tell the doctor. If you're having shortness of breath, or you're having palpitations, or you are feeling nauseated, these are things that you really need to report to the doctor. So write them down so that when you get to the doctor, you can just go to your notebook, open it up, and you have everything written down there, and you don't have to be forced to remember. And again, be honest. If you have not followed the recommendations, share this with the doctor and tell him or her why. And this is what I was saying about when you describe your symptoms, describe how your symptoms affect your daily life. So just don't say, I can't do things like I used to. Be very specific. So some examples are, I used to sleep 8 hours a day and now I'm sleeping 12. Or, I can't walk to the mailbox anymore. It makes me short of breath. So now I have to wait for someone else to get the mail for me. I get short of breath very easily. If I walk to the mailbox, if I walk from my bedroom to the bathroom, I have to hold on to something because I can't get there without being short of breath. Or I have trouble for standing for more than 10 minutes. I can stand, but then for 10 minutes and then my back really, really hurts and I have to sit down, or I have to move, or I have to walk. So be very specific about how they're affecting your daily life. So there are some other questions that you should ask your doctor. And some of the questions is important for them to know, and ask them at the beginning of choose two that are most important to you and ask them again at the beginning of the visit. Very, very important, before they're running out like crazy. So asking questions and providing information to your doctor and other healthcare providers can improve your care. Talking with your doctor builds trust. Telling your doctor the truth builds trust and leads to better results, quality, and safety and satisfaction. Quality healthcare is a team effort, and you play the most significant role in that partnership. So some of the questions to ask your doctor are listed here. What diseases am I at risk for based on my evaluation? What issues do I have, and how do I manage them? Do you recommend any tests? And what can I do to help improve the condition? Can I exercise more? Can I change a medication? Can I take it at a different time? Should I change something that I'm eating or the time of day that I'm eating? Will any medications that you prescribe interact with those that I already take? Very important question. How long, why do I need to take it? How long do I need to take it for? And of course, why? If I feel sick or have medication side effects, do I call you or do I go to an emergency room? What happens if you are not there and you're serviced? Do you have a service that will get back to me? A really good question is, what happens if I don't do anything that you're recommending? What will happen to me if I don't do what you're recommending? Very important question, so that you know how taking the medication or following the prescribed treatment plan will help you. Are there any programs I can enroll in to help me in my treatment plan? Should I go to Weight Watchers? Should I go to a smoking cessation program? Should I take a cooking class to learn how to prepare healthier ways to prepare food? Another question to ask is, who in the office can I call with questions? Should I speak to you? Do you have a nurse practitioner or a PA that will answer my questions? What happens if I feel that it's more serious and I need to speak to you? Will I be able to speak to you? And finally, when do I schedule my next visit? And should we think about doing any tests before I come back so that you'll have the results when I actually get to the office. So those are all the questions and things that you should keep in mind before when you go to your doctor's visit. When you get to the office also, it's always important to know who's who in the doctor's office. And sometimes people have a hard time figuring out who's who. So you know that there is the doctor or the physician, can be a male or a female, and that is the one who really prescribes most of your treatment. They can also have a nurse practitioner who is an advanced practice nurse, someone who went to medical school, went to nursing school, and then went on for further training, so that very often they can also prescribe medication or prescribe a simple treatment plan. Not as in-depth as a physician, but certainly for simple things. They can treat you for a cough or a bronchitis or a cold or things like that, or an infection. A physician's assistant goes to school to learn how to treat you for certain things, and like a nurse practitioner, they can prescribe medications and simple treatment plans. And that the initials for a physician assistant, you may have heard them referred to as a PA, and a nurse practitioner, you may have heard them referred to as an NP. There may be a registered nurse who the doctor will rely on to explain things to you when he has to go see the next patient. So the doctor may go out, and then the nurse may come in and help you figure out what the doctor said and help you understand better what the doctor said. Sometimes if the doctor is affiliated with a teaching facility, then they might have medical students with them or residents in training who will be there for your visit and will be with the doctor to help learn the best way to treat patients for certain things. So if you are uncomfortable and you only want the doctor there, it is your right to say that you do not want someone else in the room. And then there are technicians. There are technicians who will draw your blood, possibly. There are technicians who may do an EKG or an X-ray, and all of those people also may be found in the doctor's office. While we're talking about the doctor, I just want to put in a quick plug. Please don't forget your dentist. When you're talking about your health care, your dental care is also so very, very important. And why is that? And that's because people who have gum or periodontal disease or problems with their mouth are twice as likely to have heart disease. And periodontal or gum disease can worsen an existing heart condition or provoke an existing heart condition. So, and also very often, if you go to your dentist regularly, sometimes a dentist can see things in your mouth before a doctor sees them in your body. So very, very important to go to the dentist and practice good oral hygiene. Brush your teeth twice a day. Make sure that you floss every night before you go to bed, and get your teeth cleaned every 6 months. So that's my plug for the dentist. When you are going to the doctor, seek out the help of your family and friends. You don't need to go it alone. And sometimes it's really always a good idea to have another set of ears and eyes in the room with you, especially when the doctor is describing your treatment plan. So people who come with you often help you stay motivated. So if you say, oh my God, I don't really want to stop eating that, they might say, well, you know, I'll help you find something else, and they'll really help you stay motivated in your care. And people who seek the help of and support of family and friends are often more successful because they do have support. They do have support. And friends and family are a great source of positive reinforcement. So if you are eating right or you're exercising, they will really give you positive reinforcement. They'll tell you you're doing a great job, and they may even do it with you. If you've stopped eating fried foods or fatty foods or sugar or high sugar foods, they may do it with you, and as a result, your whole family becomes more healthy. And ask them to help you in different ways. You can ask them to come to a doctor visit. You can ask them to join you in your exercise routines, such as walking. And you can ask them to shop with you so that you can learn to buy the things that are most appropriate for your condition, and also to cook with you so that you can cook properly and maintain the best health and eat the best, healthiest food. So that is really how to make the most of your doctor's appointment. But I feel that I would be remiss if I didn't address the pandemic that we've all been in the last few months since March. Because what happened as a result of the pandemic, whether people could not go out or people were afraid to see their doctor because they were afraid of contracting the virus, it's been reported that almost half of all adults skipped or postponed medical care because of the pandemic. That's nearly half. And that means they postponed their well visits, they postponed their sick visits, and as a result, more than 10% of all people have now got worsened conditions. And doctors are now becoming even a little bit frantic that people need to come back for their regularly scheduled medical visits. People have put off getting chemotherapy, and people have put off seeing their pulmonologist or their oncologist or their cardiologist because they were afraid. So it's very important that you do go back to your doctor now when things are easing up, especially if you have a serious illness or a chronic medical condition. So I'm just going to go over a few things that will help you prepare for the visit if you haven't been there in a while, and also help you feel more comfortable about going back to the doctor. So before you go in, give yourself time to learn about your doctor's preparations. Ask them what they're doing to address the pandemic. Ask them what they're doing to keep the office clean and distance patients from one another. So this way, when you go in, you will feel more comfortable. Ask them for the exact location to enter the facility, including the street and the door. They might not have you coming in a main entrance. They might have you coming in a side door, especially if you don't feel well. They might have you coming in a different entrance so that you're not exposed or exposing other patients. And your requirements for arrival. What do you need to do before you get there? Do you ask? Do they require gloves? Will they screen you? Will they be asking you questions about COVID-19? If I have symptoms before my visit, who do I notify? Who do I tell? And do you want me to come in and be seen? What if I want my daughter to come with me, or my son, or my husband or wife? Can I bring someone with me? Because some medical centers and doctors' offices are not allowing caregivers to accompany patients. And be sure to ask what policies are in place ahead of time before you go. And if you're sick and have symptoms, let the doctor's office know before you come in for that scheduled visit. So another thing that has come to pass in this age of pandemic is that we are using much more telemedicine. And that's what I mean by that, virtual. So telemedicine is a great option for seeing your doctor, and there's been a huge surge in virtual visits as a result of the pandemic. Your doctor can't examine you during a virtual visit, but may be able to follow up with you about your progress and your treatment if no exam is required. Doctors may also have the ability to set up special equipment in your home so that the information can be transferred to them electronically, and they will know what your blood pressure is, what your pulse is, what your oxygen level is, and what your EKG is. So they may be able to put special equipment in your home. Ask if you can do tests in advance so that you can go over the results and plan your treatment together. So make sure that you can do this ahead of time. And for telemedicine, you need to ask them what kind of equipment you will need and which service do they use. Are they going to use Zoom? Are they going to use Teams? Are they going to use Skype? Are they going to use FaceTime? So it's important for you to know ahead of time so that you can learn how to access those things on your computer and learn how to use them ahead of time. So you will need access to all of this new recent technology that we're actually using right now on Zoom. And the direct-to-consumer platform, all of these things can run on your smartphone. Some of them can run on your smartphone. Some of them can run on an iPad or a tablet. Some can run on a laptop and on a desktop. So you will need to know, ask a family member to help you with that and figure out what things you need, and they can help you download whatever equipment and functioning and technology you need in order to be able to do that visit virtually. Be sure that when you speak to when you try these things, that you have sufficient Wi-Fi, that your internet is in place, and that your cellular connections are good. Also be sure that whatever device that you're using has a camera so that the doctor can see you. Sometimes very old technology, very old computers don't necessarily have a camera, and then you won't be able to see them. And test in advance and make sure that your setup works. So I hope I've covered everything. You great audience, and if anyone has any questions, I'm happy to take questions.
I think we have a few in the chat here. I don't know if H wants to come on, but it looks like the question is, at what age do you start shingles vaccine or pneumonia? Is it needed for all people or only those with underlying conditions?
The pneumonia shot, there are 2 pneumonia shots. One should be taken before the other, and really optimally should be started about the age 60, and then the second one should be taken after that. And yes, you do need both. The shingles vaccine, you should be taking again about over the age of 60, unless your doctor requires it before. The shingles vaccine is really specifically for those people who have had, it just went out of my head, who have had
Chickenpox?
chickenpox, thank you. Sorry, thanks, Janita. I see you.
Summer brain.
right, a little fuzzy brain. The chickenpox vaccine, because having the chickenpox vaccine, not the chickenpox vaccine, but the actual disease chickenpox. So having that never leaves, and that being in your body forever can predispose you to develop shingles. So most people will need it somewhere around over age 50, but there are 50 or 60. Some doctors may want you to have it earlier, especially if you have underlying health conditions. You also need to consult with your doctor to see if you can take these vaccines if you do have underlying health conditions.
And I think H had one more question. My daughter is aging out of a pediatrician. I prefer she goes to a younger woman doc rather than an older male doc. Any recommendations on how to locate a good doctor locally for her? My friends have older male doctors too.
I think that you can go on the website of your local hospital and ask them, and you can type in the type of doctor that you want, because very often when you ask for a doctor, they will ask you the gender, the age, the location, and things like that. So you can really tease out the kind of doctor that you need. The other thing is to ask another doctor that you have for a recommendation, or ask a friend, because I'm sure that your friends have children the same age who are also having that same issue of aging out of the pediatrician. The other really good resource is ask the pediatrician, because the pediatrician knows that they can't see your child forever, and they might have a really great recommendation. So do check the hospital, ask your friends, and do ask the pediatrician or other doctors that you might trust.
Let me see. I'm gonna unmute you guys if you have any other questions for Lori. Lori, thank you so much for doing this today. We really appreciate it. If you guys don't feel comfortable saying it out loud, you can also use the chat. All right, I think I unmuted everybody that I could. Feel free to go ahead and mute yourself again if you don't want to be unmuted, but I did unmute everybody just so you could ask a question if you want to. Anybody else?
I have a question. My dad is trying to find a gerontologist, and we don't know how to go about finding one. I know you mentioned going on a hospital website. Are there
Right.
recommendations?
You can go, what was the last part of your question?
Are there any other ways to find a gerontologist?
There are. So you can go on your hospital website.
Right.
You can Google gerontologists in
Right.
your area. The other thing that you can do is you can check your insurance plan
Right.
for a list of doctors, and they're listed very often under their specialty. And you can find somebody who specializes in gerontology.
Okay.
A really good way. Most gerontologists will also have privileges at hospitals, at certain hospitals. So it's going through a hospital is a very good way, because you want a doctor who's affiliated with the hospital that you feel comfortable with. So if your parent needs to be admitted to the hospital, you know they'll be admitted to the hospital that you are most comfortable with.
Great. Thank you.
You're welcome.
Does anybody else have any other questions for Lori? Okay, I think that's about it, Lori. Thank you so much for
Okay.
doing this for us today. We really
Oh,
appreciate
it's my
it.
pleasure. I hope everybody enjoyed it, and everybody stay well, be well, and remember to go back to the doctor for all your well stuff.